Hey guys, welcome back to my channel. I'm Monique. I'm a PTA going DPT. If you'd like to catch up with what I've been talking about, you can visit my first vlog. Just click my channel and just follow my journey. Alright, so today we're going to be talking about what is a PTA. What is a PTA? Well, a PTA is a physical therapist assistant. A lot of people say physical therapy assistant or physical therapy. I've heard all kinds of variations, but it's a physical therapist assistant. And what physical therapist assistants go through before becoming one is the same kind of process that any other program goes through. They have to take prerequisites in order to meet the requirements for their program. About a year and a half, 2 years or so, they have to apply to the program, get in. Of course, it has to be accredited for you to sit in for the board. But they go through about 2 years. Some programs are 18 months. I've heard of some less. It all depends on, the school and what their requirements are. But you go through it, you finish up, you take a board, so you have to pass the boards to be licensed. Now, I know not every state requires a licensure. Some are just certified, but it all depends on your state. So I would check your state practice act. So like me, I practice in Maryland, so the Maryland Board of Physical Therapy is where I would go to find out any information. So the kind of settings we work in every setting. I've never seen any limitation in terms of, being a PTA. I personally have worked in skilled nursing facilities, outpatient clinics, shared outpatient chiropractic clinics, acute care, so hospital settings, acute rehab, inpatient settings. I've worked with the military, I've worked with civilian, I have worked home health, I have done everything but pediatrics in a trauma center. So we can work anywhere. The cost of tuition varies. Obviously, in-state versus out-of-state factors in. But for me, my program at the time when I took it was about roughly, I'd say like $9,000, $10,000 for the 2-year program that I did. By the time I came out, I had paid that money. So I came out of school debt-free, which was awesome. So the cost compared to the DPT, I mean, there's no comparison there. It's awesome. So for anyone that is afraid of loans but wants to do physical therapy or does not want to live the rest of their life paying loans, PTA is the way to go. It is payable within your first year as a PTA if you're serious. I know that some programs go up high, but I've not heard of anything more than like 20, if that. But correct me, I stand corrected. The potential for earning. So you can earn as much as you want. Yes, you can earn as much as you want. It's all about marketing yourself. You have to market yourself as the best thing that there is. Even coming out of school fresh, you have to market yourself so that your employers see that you're there to learn, you're there to do your job. When I came out, I was 20 years old, and I was making $28 per hour for my first job, and I climbed right up, within a span of 2-3 years. I remember about 2.5-3 years after coming out of school, I was able to make 6 figures one year because I was working full-time and I was doing like a PRN position on the weekends, like every other weekend or every 2 weekends or something like that. So you have the earning potential of PRN up to $50+ per hour. It all depends on, again, the setting and how you market yourself. So there's that potential. So I'm going to talk about some pros and cons of being a PTA from my experience. Again, this is not for everyone. The number one pro for me is obviously less schooling compared to the DPT. The DPT, you have some programs that are going up to 4 years now, the hybrid programs, but the majority of them are 3 years. So you do your undergrad for 4 years, and then you do 3 years of the program. Versus PTA, you do your prerequisites, which a year and a half, 2 years, you can complete it, and then you do your 2 years or whatever if your program is months of the program. So definitely less schooling. Obviously, number two, less loans. Again, I paid $10,000 roughly when I was done with school, and so $10,000 versus, PT school can go up as high as, I've seen people with $300,000 loans because they have to live while they're in school. So you have $10,000 versus $300,000. Which one would you choose? Obviously, $10,000. And then you have less responsibility compared to the DPT. Now, less responsibility is relative, but in terms of documentation, in terms of being in charge of the patient's entire care under physical therapy. PTAs don't have that much of a burden compared to the DPT. We, of course, have our set patients, we follow them, we do our interventions, we reassess, we assess, we make recommendations, we educate the patients and their family members. We do a whole lot of things, but at least, we don't have as much documentation and other administrative duties on our plates like DPTs. Another pro that I love about being a PTA is that we could do whatever, we can work wherever we want. We could specialize, we're flexible. I've met PTAs with vestibular experience. I've met PTAs with cardiopulmonary experience. I mean, it's a wide range of specialties that you can get into as a PTA. And even I encourage PTAs and people who are going to join the profession to join the APTA. I remember when I was coming out, I thought the APTA is a waste. But to be honest, after going back to school and actually being required to get an APTA membership, it is a great resource to learn from other PTAs in the field and just to pull from some of the knowledge from some of the chapters that are in the APTA body making organization. So that's, that. Now for the cons. Okay. So my reason for going DPT was I had burning questions as a PTA. I was educated well enough to know what the plan of care was, but the problem was that I could not make certain decisions. I was limited. My scope of practice was limited because I have to function under the supervision of a PT. So that's one limitation, is that you are autonomous in the way, but then you're still accountable to the PT. So you cannot necessarily make just any kind of decisions, especially if it's not within the plan of care. You still have to consult the PT when you feel that someone needs a reassessment or needs to be discharged. So there's that, kind of shaky side of it. Again, I mentioned number 2, the scope of practice is limited. So I can only do so much. I can only do so much joint mobilization, so many grades. So I'm limited, and that's one thing that caused me to go back to school was I knew what to do. I just needed that extra skill set, that extra education, that willpower to do it without being, freely, because the PT is pretty much the principal in the physical therapy realm in terms of, the person who makes the main decisions, initiates the initial evaluation, discharges, and all that. And then number 3, you still, even PTAs that own their own clinics, and I think that it's awesome, you still need a PT to do the assessment. So it sucks. I know that, we're educated enough to probably even do an evaluation, maybe not a full evaluation, but we can't because our scope of practice says that we are not prepared for that aspect, and it's true. So unfortunately, we still need a PT in order to get our own caseload and work. Again, from experience, I enjoy being a PTA. I think it's an awesome field. You have the potential of earning, from, I've seen as low as, 50,000 to up to like in the hundreds. There are PTAs that make very good money. So less education.